Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop brain fog. So this is very special topic to me because after my second cancer treatment, I used to suffer from memory issue, brain fog, and chronic fatigue. And I saw several healthcare providers and I was not able to really get to the root cause of the problem until I started to study nutrition, read a lot of books, going over a lot of studies to get to the root cause of my symptoms to overcome this issue. And a lot of these causes I will go over that I personally experienced it, and that's the approach I use it with my patient to really get to the root cause of the problem. So make sure you watch this video to the end because there's a lot of important information in each step that you might be able to take it at home to overcome brain fog. So before we start, we need to understand what is brain fog. And I'm gonna go over briefly the long-term effect of brain fog. The causes, that's very important. I'm gonna go over 5 causes, and I will give you an extra cause that's very a bonus for this video. 6 causes that actually trigger or lead to brain fog. And then we'll go over the treatment, what you can do at home to really overcome this issue. Okay, so what is brain fog? Brain fog is not a disease, it's a symptoms. And you will know after going over the causes that's a symptoms of a lot of health issues. So the symptoms of brain fog, you probably will have poor memory, inability to focus, lack of mental clarity, difficulty concentrating, mental fatigue, and cloudy thoughts. And usually you wake up in the morning and you feel like you're very off and you just need to have time so you clear your brain. So long term of having these symptoms could lead to depression. The end result of memory issue or memory loss is dementia and Alzheimer. That's why if you are experiencing that, take it serious, because it will not improve by itself unless you take an action, eliminate the causes, and work on how to get your body back to normal. So we need to address that. So now we're gonna go over the causes. Okay, first cause that's overlooked by a lot of healthcare provider is the relationship between brain fog and the thyroid hormone, the T4 and T3, and I have a video on the hyperthyroidism and talking in detail the relationship between that and the memory. So those the hormones that's related to brain fog, T4 and T3. And the other gland that has a huge relationship is the adrenal gland. And the adrenal gland's hormone like pregnenolone, DHEA, testosterone, estrogen, progesterone. Unfortunately, DHEA and pregnenolone extremely overlooked by healthcare providers. And I personally had a lot of healthcare providers working with me. None of them tested the pregnenolone level. And I will have video on that, why this is extremely important for memory. And if you don't know your levels, you're really missing on knowing the root cause of the problem. As I mentioned to you, brain fog is a symptom, so it could be related to a lot of issues. It's common with these hormones, so you need to properly evaluate it to know if you have deficiency in those. So the second common reason is vitamin deficiency. Those are the most common vitamins that are usually relevant to brain fog. And I put B vitamins, there is 8 B vitamins, because all of them working together synergistically to improve your brain function. So it's very common to have with those patients B deficiency. Also C deficiency, D deficiency, and K deficiency. So hormones could be an issue. Vitamins could be an issue, and the third reason is mineral could be an issue, because you need a lot of these vitamins and minerals for your normal brain function. So the mineral that's relevant to brain fog: low magnesium, low iron, low iodine, selenium, and zinc. And I have video on most of these, how to figure out if you have deficiency on these issues. And it's very common when you get to the point of chronic brain fog. It's not only mineral deficiency. Usually there's vitamin issue. Usually there is a hormonal imbalance. And when I treat those patients, and for myself, I actually had severe deficiency in magnesium, iodine, zinc, selenium, and I also had D deficiency, but the healthcare I worked with has not been evaluating a lot of these deficiency. And I start to feel better when I start to address those deficiencies simultaneously with the hormonal imbalance I had. So I had thyroidectomy, so I did not have thyroid gland to really produce T4 and T3, and I have to have a special treatment for that, and I had to work on myself to really get my level back to normal. So hormonal imbalance, vitamin imbalance, mineral imbalance. The fourth reason or cause that you can address at home even today is diet. Refined carb, refined sugar, it's gonna cause brain fog. It's gonna deplete a lot of your vitamins and minerals. So stop that as soon as possible. Refined carb, refined sugar. If you're drinking alcohol, that's gonna cause issue with your memory too. I will avoid that. Artificial sweetener, processed food. You can take an action today. If your brain fog related to diet, when working on those elements, that will help you. But it's very typical. It's combination of diet, inflammatory diet, and deficiency. The other thing, and I will go over that in detail, food allergies. Some people have allergies to certain food, but they're not aware of, and usually they eat it on a daily basis, and that could cause brain fog. So the fifth reason that's actually overlooked by a lot of healthcare providers, and I will tell you what was happening with me after my cancer treatment, is medication that may cause memory loss and brain fog. So these are the list of the medication. As you see, it's a long list. I personally used to take opioids that will actually cause memory issue. So there's a lot of patients could take one or combination of those medication, and that could increase the risk of having memory issue, especially if you take it for a very long time, because a lot of these medication, and you will notice if you watch other video I have, that could cause magnesium deficiency, iodine deficiency, cause B deficiency, D deficiency. So it's kind of like that deficiency is another trigger plus the medication. So if you have couple of these causes at the same time, you increase your risk of having memory issue. So I highlight the most common medication because it's used by a lot of patients, and they're not aware long term could cause memory issue and brain fog, like antidepressants, cholesterol medication, blood pressure medication, Parkinson medication, and you can read this list, and chemotherapy. So if you've taken any of these medication, make sure you consult your doctor. Some of these medication you can, if you manage your symptoms, you can avoid it, but you have to work with the healthcare provider to guide you through this process. So the last one is overlooked, the toxicity. We are exposed to a lot of toxins like mercury. You get that from fish. That's very common. I personally do not eat fish. Very rarely I eat fish because it's higher in mercury. Also the silver filling, the amalgam in the teeth, that usually leaked when it's wear out in your teeth, and that's toxic to your nervous system. It's gonna cause issues. Lead usually in old houses, buildings, and mold, and that's very overlooked with a lot of people. So these are trigger for the brain fog. So think about this way: if you have combination, and it's very common, the deficiency occur in several vitamins and minerals simultaneously, and at the same time, if you're taking medication, you increase your odds to having more issue with your memory. Plus, if you're exposed to any of those toxic, you really is speeding up the process to get to the long-term issue, which is depression, dementia, and Alzheimer. This is very complicated symptoms, and it's require comprehensive evaluation. So what you can do at home today to really address this issue? One of the things that you can take advantage of is Ask ASTR. This is a free online medical evaluation. It usually takes 5 minutes to answer the questionnaire, and the software will help you and guide you through possibility of hormonal, vitamins, mineral deficiency. The software will include at least 9 healthcare provider database: nutritionists, endocrinologists, cardiologists, neurologists. So it's a very comprehensive evaluation that will help you to figure out what is the possibility. This is a condition that patient by themselves will have hard time to figure out. I personally spent years to study all of these elements to figure out how to evaluate it properly. So the option is you can take advantage of the free online medical evaluation, or the other option, feel free, if you have any question, you leave it in the comment below, or if you want me to work with you on this condition, click the link below to contact my office. So I will see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below, or go to asterinstitute.com.